Hello, everybody, and welcome to another webinar of I Love Homeopathy. I Love Homeopathy is an initiative of Bahola Labs, uh, which manufactures homeopathic medicines, and we thank them for their support. This evening, we have a very, very good speaker with us, Dr. Jamil Said. I know of him, but I know his father even better. He's the son of a stalwart of homeopathy, Dr. Ismail Seth. Um, I think Dr. Jamil is going to further what his dad has done, and we are here to uh, help him and show our appreciation for all the work that he's doing for homeopathy. He's part of Sahya. Sahya, I've told you every month we have a speaker from Sahya. Sahya is an organization which is started by Dr. Biju Nair, and where he mentors homeopaths. And it's by invitation now, I think. Am I right, Dr. Jamil?
Yeah.
It's by invitation now because they've got more than 2,500 people in their under their fold, and they conduct now I think a webinar series that they're going to conduct now, which should not be missed. If you haven't registered for it, I would advise you to register for that. Now, Dr. Jamil is a very important part of Sahya. He is one of the core uh, doctors who help mentor younger homeopaths, and which is why we have asked him to come on to speak to us, to speak to our friends here. Uh, he's a specialist in obesity. I think Dr. Jamil will say a few words about himself, about what he's done for obesity, and how he got interested in obesity. Dr. Jamil, can you share
Yeah.
with us how you got into this particular subject of obesity and how homeopathy and uh, can help along with
Yeah.
that?
Yeah. Perfect.
Yeah.
Perfect. Yeah. Hello. Good evening, everybody. So, why I am into obesity? That is a big question because what I'm going to share today will be completely my own experiences. It's not that I have studied it from someone or I have gone through many books and studied about obesity is or how to manage obesity. It's all my own experiences what I'm going to share. So one thing different will be I just want this section to be more of interactive if possible, so that you can ask whatever doubts you have, so that this section become more interesting, and I hope I can answer these questions because I have gone through all the difficulty what an obese person would have gone through, because I was nearly 122 kgs of weight my initial phase when I joined Sahya. But as you told me, Sahya mentors people. Sahya has never told me to reduce weight or nothing like that. But Sahya shown me what you must be or how a homeopath professionalism must be. So automatically, I was much impressed, and automatically, what I did is first thing I has reduced my weight. It's all because of Sahya, which has promoted me, or it has shown me the path how we can, because it is one of the most weakest point what I had was my obesity. But I believed in when I was before joining Sahya, what I believed was obesity is one of the greatest what to say plus point of myself, because a person who has met me once will never forget me. That was what I felt because I'm so obese. But later I understood it is not because they remember me. It may be because of that huge structure they may be remembering me. But that is not the thing what we have to give a person. That is not the impression what we have to give to the other people. So later I started changing, and all the difficulties what an obese person can have that I have faced and I have overcome it. So here we will be discussing more of that. So let's see what I we have to speak on or what we have to discuss, and later I think it will be more of clear what I am supposed to tell here, right? So doctor, let's move
Yes,
on to the
yes,
topic.
please. Yes, that'll be interesting. And it's amazing that you've come from 120 to what you are now. You're like a model now.
And I
In
should
your
say,
photograph,
yeah.
yeah,
And one thing I should say is, as I seen in your FB, you are a cyclist too, right? And
yeah.
even I'm a cyclist too.
Oh, very good, very good. We should
I'm
we should
cycling for the
go and.
past 5 years. I'm cycling for the past 5 years.
Oh, okay, very nice.
Yeah. So we'll come to the topic, and I think it will be more of interesting. I just want people to be more of interactive, so we can ask whatever doubt you have. Okay. So we'll be talking on integrative approach on homeopathy and diet in management of obesity. I can rather say your diet is very much important here, because most of the cases when we give a fighter like a tincture or something like that, it alone may not help you to manage obesity. It may help you to reduce initial weight like 3 kgs or 2 kgs, but later what is the final outcome, that will not be eligible, because our body have the utmost capacity to adapt. It's adapting to each and everything. Even you can see whenever you do an exercise or cycling or whatever it is, after a few days or after a few months, your weight becomes stagnant, because your body is tend to adapt to whatever situation you give. So it's our duty to confuse everything, your body. So to start up with, I should thank my mentors. One is my father, Dr. Ismail Said, and one is Dr. S.G. Biju of Sahia, and all my teachers who has teach me and shown me the right path of homeopathy from the beginning. So coming to the topic, obesity. First, I should say you, obesity, as even I taught before, obesity is not a disease, because one thing we have to understand is, if you are obese, till you are able to do everything and you're happy with it, it's fine. It's not a disease. It's not that you have to reduce weight because of some other people's compulsion. It must come from your mind, and it comes it from that patient who wants to reduce. Even though I may get many cases where, yeah, the patient is not so obese, but they tell that they are obese and they want to reduce weight. So even so-called cases also that it is an obesity according to the patient. So we have to see that. So basically the effects of obesity, as you know, obesity is not a disease, but this obesity can lead to many other diseases. That is most common is cardiac problem, like congestive cardiac failure, all these things, heart attack, all these things can happen in obese patients. Then high BP. Understand one thing: when a obese person of like 1k, 100 kg or 122 kg, it's very common to have a BP of 140 or 160. Uh, don't think that it's a high BP, because it is very common, because their body is so huge. The heart must pump the blood, so automatically the BP will be raised. Okay. Then coming to the stroke, type 2 diabetes, insulin resistance, gallbladder, gout, osteoarthritis, and you know all these things, sleep apnea, osteoarthritis because of the weight, all these things. So these are the very common things which affect, which is caused by obesity. I don't think I have to explain much on this, because we have a lot to talk later. Then reasons of obesity. This is one of the important part we have to see when we start with. One is the physical inactivity. Old people tell that a good doctor will be obese, because you don't tend to move. You sit in single seat and practice the whole day. So automatically, it's because of physical inactivity the obesity is caused. But now I think the trend has completely changed. Even doctors are more prone to be more fit, or they are more likely to have a good lifestyle now. So it's even our homeopaths must have these type of thoughts to have a good physical outfit. And the second thing is very much common: overeating. Then genetics, diet in high in carbs. Then frequency of eating. This is one of the major part. Like some people come and tell you that I have belly fat or something like that, or it may be like the according to the BMI, it is 70 is the normal weight. They have 72 or 74 kg. Tell them to reduce the frequency of eating. That alone will help them, because most of the people have a bad habit of snacking, especially the women in the house, housewives. They just have snacking wherever they sit, or whenever they do work, they just tends on snacking the food. So this is one of the reason for obesity, and especially in the abdominal fat, because every time you eat, your insulin is deposited, and the insulin's job is to store the food to as a fat. Okay, then medications like steroids, all these things can cause obesity. Then a psychological factor. This is one of the important. Like even I face this, because when I was having the exams or something like that, when I'm stressed, I need good food or I eat more. This is very common to many of the people. Some people may get depressed and reduce food, but most commonly depressed people eat more of food. So this is the psychological factors which is affecting the obesity. Then some diseases like hypothyroidism, insulin resistance, PCOD, and Cushing syndrome. Here there is very much importance for homeopathic drugs to treat these diseases. If you treat these diseases, you can get rid of obesity. So whenever you get an obese person, it's not just phytolacca tincture. Think of something more deep into the diseases, and we can sort it out. This to the basic and most important thing, that is decreased BMR and increased fat accumulation. Decreased BMR means, um, you may have seen when you are practicing, the doctor patients come, they tell doctor, I don't eat anything, I don't eat anything, literally nothing, but still my weight increases. This is because of decreased BMR, because most of the fat obese people tends to diet. Okay, diet means they may reduce food, or they may look into the internet and follow some sort of diet. So when you reduce this diet, what I hope you know what is BMR is. It is basal metabolic rate. That is something like your vital organs work with this energy. Your heart, lungs, brain, all these work with this energy. Even though you're not doing any workout, this much of energy is very much required for your body to work. That is BMR. So automatically, when you eat very less, your body tends to adapt to that energy which is received, or the body tends to sacrifice. This is the most important term, sacrifice, because you may have seen the people who are doing a diet will may tend to get thyroid complaints, skin complaints, or hair loss, many other, or dry skin, such complaints. This is because of sacrifice. Your body's most important is vital organs. So when these vital organs are not getting enough energy, body will not supply energy to any other organs or any other system, like thyroid, all these systems, and try to preserve this energy for your brain, lungs, and other systems. So there your BMR is decreased. This can be when you see the people who is dieting may sleep too often, or they may be very tired. All these are signs of decreased BMR. So this decreased BMR will increase weight in future, because now you have decreased BMR, later body adapts and body is not reducing weight. Suddenly you think, okay, now it's not, as it is not reducing, let me increase my food. And you increase the food, BMR is still reduced, and your fat accumulation is more. This is what happens in people. Even you can see the people who are goes to gym, after you stop the gym, you may increase the weight, because your body, when you do gym, your body BMR is increased. Later, in that case, it is increased, and your appetite is increased, you eat good quantity of food. Later your weight reduces, and after some time, when your body adapt to this BMR or activity, suddenly you stop the gym, and your BMR reduces, but your intake of food still remains same. So your weight increases. That's the reason why when you go to gym, you increase the weight after you stop the gym. Okay. So this uh, this both are interconnected to each other. Okay, so now coming to the other point, that is BMI. I think most of doctors will be following this system of calculating obesity. Most of the people tell, okay, it's according to your height, this is not the weight you must have, you must reduce weight, all this stuff. But according to me, my own experience and my logic, what I felt is BMI is one of the greatest foolishness in the obesity field, because uh, a person who is very much good build, or someone like Mr. India, or someone like Arnold Schwarzenegger, he will be weighing in 123 to 130 kg of weight. Still, you cannot call him obese person, right? So, so your weight and height, when you calculate each other, it may be like BMI is high, but still you cannot name him obese. So here the BMI concept is gone wrong. The BMI can be only calculated in the basic sense, it not in a higher sense. So what I prefer is fat percentage. How much percentage of body is fat? Okay, it may be like for you may have heard about the size zero. This size zero means 0% of fat, which is possible for males, not possible for females. Females must have an average of 20% of fat in their body, because their body structure is made like that. Okay. Then now we come to the BMR, basal metabolic rate, what I have told you. This must be calculated before treating any cases of obesity, and minimum quantity of food must be given according to BMR. To calculate BMR, it's very easy. To be very easy, you can go to any apps, online apps, and you can just enter the height, weight, waist circumference, hip circumference, neck circumference, wrist and forearm circumference, and you get the BMR there. First, you have to calculate the fat percentage, then you go for the BMR, and you get a BMR. According to that, you give a patient's diet, and to be fine. I spend approximate 45 minutes to 1 hour in a single patient who is coming for obesity. So I don't practice obesity every day throughout the month. I practice it only 4 to 5 days in a month, so that I get other diseases to treat. Because when I treat an obesity case, I spend nearly 1 hour in single patient, and other patients will be getting irritated. So I take exclusive days for obesity. So coming to the diet part, I think you have heard of many diets like high protein diet, LCHF, keto diet, vegan diet, all these things. But here, what I'll be talking will be most of ketogenic diet or keto diet, which is very much popular nowadays. But most of the doctors don't know what keto diet is. The mostly when the patient come with the telling about the keto diet, you directly tell no, because it is extremely opposite of what we have learned till now. So my aim is to make you people aware what ketogenic diet is, because it is one of the safest diet possible. So coming to the point, I think it's very clear which is most important, which is more essential: proteins, fat, vitamins, or carbohydrates. Or have you heard about essential proteins, essential fats, essential vitamins, and essential carbohydrates? I don't think you have heard about essential carbohydrates, because there is nothing called essential carbohydrates in this world. So, as carbohydrates are not very essential, but proteins are, fats are, and vitamins are. So, when you go for a vegan diet or vegetarian diet, you may lack in protein and fat. And when you go to a high protein diet, you may lack in essential fats. So it must be very regular. What every essential things must be supplied. So as there is no essential carbohydrates, one of the best diet could be the ketogenic diet. It depends on person to person. I'll go in detail in the later slides where who can or who cannot do keto diet. But we eat more of 70 to 90 percentage of carbohydrates per day, right? This is the basic food pyramid what we have learned. And from here itself, it has gone wrong because, as I told, there is a lot of difficulties, or there are, if you have seen, even diabetes and cancer has more can be controlled with this less of carbohydrates. This carbohydrates feeds on these diseases. So when these carbohydrates are stopped, these diseases can be controlled very, very, very well. Okay. And even excess of protein leads to glucose. I think you know about that as your doctors. I don't want to go detailed to these matters. Like your body needs, you can body can run on glucose, and you can body can run on ketones. That is two energy sources which your body can run. And most commonly, it is run by glucose. That can be from carbohydrates, and if you're even having more of proteins, also this glucose can lead to. Uh, do you know what is the basic or more? What is the quantity of proteins required for a body? It is approximate zero point 0.8 to 1.2 grams of protein per lean body mass. So taking into average, it is 1 gram of protein per lean body mass. So what is lean body mass? Lean body mass means, excuse me, lean body mass means your body weight minus the fat percentage or fat mass leads gives you lean body mass. That is your proteins, uh, your bones, your muscles, your bones, and your skin altogether leads to this lean body mass. Okay, so lean body mass into 1 gram. So for calculating an average average Indian who is approximate 70 kg of weight, your lean body mass will be approximate 60 kg. So 60 into 1 gram is 60 grams of protein per day. That never means 60 grams of non-veg is in, or 60 grams of egg, or 60 grams of pulses, or 60 grams is not enough for the body to get its protein. Just imagine one egg only has 6 to 7 grams of protein, or 100 grams of chicken only has 26 grams of protein. That means an average Indian or average person must have approximate 200 grams of non-veg, or 10 eggs per day to fulfill the protein content. Okay, so that's too huge, right? So we taking these essential proteins per day? No, right? So whatever diet what we are following till now, that has many lacunae. So that can be controlled, or the knowledge of these dietetics can help you to build a better body or better person as for the patients. So coming into the topic proper, that is ketogenic diet, it consists of 70 percentage of fat and 25 percentage of protein, and 5% of carbs are as needed for a person to be on ketogenic diet. So this is the calculation part, but average Indian needs to limit within 20 grams of carbs to be on a ketogenic diet. 20 grams of carbs. That is very less, very, very less. So that is the need to be pushed into ketogenic diet. Don't misunderstand me by ketosis and ketoacidosis. Ketoacidosis is the complication of uh, diabetes or many other diseases like that. But ketosis is very much natural, which can be more promoted through diet or fasting. This is the basic food pyramid for a ketogenic diet, where more of meat and less of carbs. That's what happens here. So to explain what is happening, because now in your mind there may be many doubts. That is, uh, what we have learned till now is take less of fats and more of carbs, right? So here I just like to explain you something. If I give you some rocks, and if I give you some bricks and tell you to break any one of it, I'm sure most of the people will break only bricks, right? And you won't go for rocks, because it is very much easy to break bricks, and it's very tough to break rocks. But you won't just waste these rocks. You don't throw away these rocks, because rocks are more stronger than bricks. and you keep it for yourself so that you can use it for the future, right? Similarly, your body do. The body, when you eat something very much rich in fat and carbs, your body tends to break only carbs, and this fat is stored so that it can be used in the future for when you are in need of food. But thank God we are not in such a situation um, to starve for food. If we are starving for food, this rocks may be used up. But as we are good enough, we are not starving for food. So automatically, what happens is rocks are still there, but bricks are used up. Okay. So what is the easiest way to make you break rocks rather than bricks? The easiest way, what I felt, or is like stop supplying bricks and supply only the rocks. So you are compelled to break the rocks. Maybe in the initial phase you may feel some difficulty, but later it will be fine. So this is the easiest method by stopping the supply of bricks. The same thing what ketogenic diet do. When your body have more of fat, give fat according to BMR so that your body tends to break this fat for the energy. And whenever you do exercise, this body stored old fat is broken up for the energy. Okay. So what this diet and our medicine do is make your body a mission which breaks down the fat. Okay, it's very common. Whatever machine you buy, or for example, sewing machine if you buy and keep it at home, and you are not using it up, that never will give you any dresses or tailor any dress. But it is the need for you to use the machine so that you get dress. Similarly, your body is converted into fat breaking machine, but you have to use this machine by doing exercise. So whenever you want to lose fat, it is very much important to have a good diet, good exercise, and correct medicine for according to your person, or some specifics which I'll talk later, so that your body can be reduced, not in a like most of the people when you see who are reduced fat, they look very sick, or their eyes will be very indrawn, or dark circles. Such things never happen when you do correctly with homeopathic medicines. So that is a what extra benefit what you can give to people. Even I don't think you can recognize me as reduced 42 kgs out of my body, because of these homeopathic medicines have helped me up. When the starting phase, I have vomited, I have fainted, all these things, but all this I have used up as a steady material. I learned on it. I took my own symptoms. I used homeopathic medicine. I edited in such a way that I suffered. I don't want my patients to suffer. Now I am very much confident that for the past 3 to 4 years, I am practicing exclusively for obesity, and no, none of the patients has complained me all the difficulties what I faced in my initial phase. Okay. So now the toughest part will be when you studied the basic thing would be a brain functions on glucose. That is the basic thing what we have learned. But understand or believe me that 97 percentage of your brain can function on ketones. Only 3% of your brain sticks on to carbohydrates or glucose. So this 3% can be covered with the 20 grams of carbs per day. Okay, so brain gets its glucose, and other nine, this 97% use ketones very well, and it is a wonderful uh, feeling to be experienced with. So is the keto diet right for me? That is the most difficult part. Like whenever patients come to reduce weight, they may be asking, okay, is this diet for me or can I do it? First thing I can tell you, if the patient is less than 18 years of age, no, keto diet is not for you. If your patient is pregnant, no, this diet is not for her. Even in the course of weight loss, there may be, if she's getting pregnant, tell her to stop the diet. If your patient is lactating mother, no, this diet is not for her. Or if your patient is having, say, about renal failure, renal difficulties, no, this diet is not for them. Okay. But the keto diet, one of the negative effect or side effect for keto diet is kidney stones. So just keep in your mind when you prescribe medicine, so when you take history, ask for the history of renal stones. If that is there, you have to take care of those symptoms also when you prescribe a remedy. Other any diseases, keto diet is wonderful for them. Okay. So ketogenic diet as a therapy. So I have talked about the weight loss or how obesity can be controlled with this ketogenic diet. But there are many other diseases where ketogenic diet can be used as a therapy. The first thing is uh, cancer. It's wonderful effect on cancer because cancer cells are not a normal cells. Or we'll come into the matter in the later stage, slides. I think I have the slides for that. Just understand one thing: whatever diet is there, there is a side effect also behind. It's not like homeopathy. It's not everything is not safe. There are many things to be asked even for the keto diet. As I told before, these conditions must be taken care. So in the cancer, coming to the point, mm, cancer cells are not the normal cells. It is a mutated cells, right? So these cells are immature cells. These cells can run only on glucose. Okay, cancer cells specialty is it is multiply very vigorously. It do not have a switch off switch. Okay, it cannot be switched off. It is always on. So what happens is it runs on glucose. So something where you can stop the production of glucose, your even your cancer cells are not switched off. It dies off or it stop multiplication. So cancer can be controlled. I'm not telling you that cancer can be completely cured with the diet, but cancer can be controlled very well with ketogenic diet. But understand one thing: the cancer which is affecting more of bowels, please do not take this diet because this diet is very much less in fiber rich diet. So automatically, when your abdomen is affected by cancer, there may be a chance of constipation and other difficulties. So, people who are having the bowel cancer or rectal cancer, sorry, this keto diet is not for you. But I had a case of breast cancer. Hope you doctors know about the infiltrated ductal carcinoma, which is one of the most aggressive cancers. Because whatever experience I have got, it most of the cases like within 6 months of time it gets very worse, even with the medicine. So it depends on some cases. It's very much aggressive. So whatever I do is whenever I get a invasive ductal carcinoma, I refer it to allopathy because it can be completely cured by a surgery if there is no metastasis. Okay, this is one of the cancer which can be treated completely with surgery. Okay, it's not allopathic system; it is a surgery which is used up. So we can tense that, and after the radiation and chemotherapy can be replaced by homeopathic drugs. So I had a patient of 70 years of age. She was not willing to take this undergo the surgery, and she don't want to go for any allopathy treatment. We told them the consequences, everything, but still she was ready to not go for surgery. So at last, I what I told them was this diet and plus our medicines, and now it is approximately 3 years, I guess. 3 years, she is perfectly okay. There is a cancer in the breast, still it's not worsened up. It is not a big wound there. It is almost a normal where it has started almost stagnant. It has got. So this is a wonderful thing. What a diet can do even in a cancer. This diet. Okay. So I know this is a PT scan where your lung, kidneys and heart is shown where there is a glucose activity is more. This is shown as black in this scans. That is PET scan. And this is of a cancer patient where you can see all the metastasis. So just see wherever the glucose activity is more, there this black parts are shown up. So that means cancer cells are more of glucose or sugar triggered. So this is one of the condition where we can use this diet to control this extent of or metastasis of cancer. Then diabetes. As you're not taking carbs, it is a wonderful thing. Even you can stop any medicines for diabetes. I think like it takes approximate 1 week. You can within a week or maximum a month you can stop medicine. Whenever you stop medicine, whenever a diabetic patients come to you and you prescribe a ketogenic diet, tell them to take medicine for the first day. A second day onwards, tell them to monitor their glucose and later let them take the medicine if required. You can see after a week, the glucose may little rise because your fatty liver is getting resolved. Your liver fat is thrown out, so automatically your glucose little spikes, and I think that medicines may be restarted in the second week if required, according to the daily average of glucose. Tell them to monitor the glucose and taper the doses of medicine. Then headaches. This diet is wonderful for migraines. You won't get migraines in this diet. Then fits or seizures. This diet was really found for seizures. Later, when these patients started reducing weight, it became a diet for weight loss. So it can have good results on seizures when there is a uncontrolled seizures. Or just take one point or one takeaway point from this case, that is, whenever you have seizures patient or a fits patient, tell them not to take more sweet. At least leave about the carbs. If they are not ready to take avoid the carbs, leave that. At least tell them to avoid sugars, and that may reduce the frequency of fits or seizures, and plus your homeopathic medicines will show wonders. Okay. Then mental confusions. I think in a video of a doctor that I saw, he was telling that how this ketogenic diet increases the mental stress or mental confusions. But I can tell you that doctor has never taken this ketogenic diet, because whenever you are on a keto diet, your mind is more relaxed and mind has more of concentration. That must be felt. I can tell you, if any of you are against keto diet also, I'm telling you, take keto diet at least for a month and you will understand the beauty of ketogenic diet. Just try it out. Then skin, obviously, as it is high in fat, your skin glows. And what about the endurance? I'm sorry, this diet is not for people who are very fast in sprint or something like that, athletes, but who are looking for the endurance. This diet can be given, because this you can see that uh, normally when you have carbs, it is a spikes of energy comes up. You may have a high in energy and you may go down as very fast as it spiked up. Your carbohydrate or glucose energy are always something like alternative current, but your ketogenic diet is almost something like DC current, where you have a stable energy always. Even if you do an exercise and you're tired, just take half an hour break and your energy will be refilled, because you are breaking your fat and your body has a lot of fat to be broken up. So automatically this energy comes up back and you will feel more of relaxed. Then understand about this low calorie diet and low carb diet. It is not of the same. Mostly people go for low calorie diet, where I told you the BMR is affected. Your body go for sacrifice. Your body tends to what to say, it sacrifice or adapt to the low calorie. But better go for a low carb. And one more thing I can tell you, that is, whenever you do give a patient diet, tell them to start with a BMR, and every month try to increase 25 or 50 kilocalories every month, so that your body will not adapt. Okay. Then one more thing, what I will tell you, uh, Hope you have heard about the Snickers, right? Even in the Snickers advertisement, you have heard it is uh, hungry kya. That's what asked, right? If you are hungry, then you can have Snickers. But what we do basically we have food, we have biryanis or pulavs or whatever it is. On that, we take a Snickers as a sweet, but I'm really sorry. This is the most worst part of our diet. We have something spicy, and afterwards you take something sweet. This is the worst part of Indian diet. Okay, so don't they take the sweets because a single Snicker bar is approximately 250 kilocalories. 250 kilocalories a single bar of Snickers, and just imagine one whole egg is approximate 75 kilocalories. 75. That means your Snickers is almost equivalent to three eggs, three whole eggs. Okay, so wheat Snickers is really made for, or when this company made this, it is real aim is to whenever you don't have a breakfast or lunch, you don't have time to have breakfast or lunch, then you take a bar of Snickers and your energy level is maintained. But what we do is really wrong. That must be corrected. So even if you are doing that wrong, or if your patients are doing it wrong, tell them. Even for ADHD complaint, I can tell you when you reduce this sugar, this ADHD can come into the control level. So no sweets for ADHD patients also. And many other diet part is something like high protein diet. Even I have tried a high protein diet, then low calorie diet. Everything works, but it is according to your mind, how much you are fixed into. Even without diet, without medicine, you can reduce fat by very good exercise. But are you confident enough, or are you motivated enough for doing that things? Then fine, tell your patients not to diet because that is the best part. But people who are lazy like me, I'm sorry, the diet only will help you, and even medicines or only exercise may not do. It must be a combination for lazy people like me who want to reduce a large quantity of fat. Okay, so any weight loss, you may have heard that 10 kgs can be reduced with 10 days of time, and you may have seen these people increase 12 kgs of weight when they just stop the diet, right? I think most of the people have experienced this thing. This is all because uh, your weight can be reduced because of two reasons. One is muscle loss, and other is fat loss. Even if your muscles are reduced, your weight reduces. So when you reduce weight, don't be happy that you are reducing somebody's weight. Maintaining it is the most important part. So your patient's muscle must not be reduced. So how to calculate this muscles? As I told you first initially, the fat percentage must be calculated and must be taken up every month so that your muscle mass can be seen through. Okay. So whenever you reduce muscle mass, it will regain. You know that muscles are the building blocks of body, right? So when it is a building blocks of body, just imagine your house, you have a small area which is destructed. You try to rebuild it, right? You rebuild it as soon as possible. You may take loan or anything to rebuild it. And when you rebuild it, you will never make it as very much similar as before. You try to modify it to more better and more stronger, right? Similarly, your body do, because body muscles are the building blocks. When that is lost, it try to regain it at any cost. Whenever you stop your diet, it first thing it do is it rebuild your muscles, and when it rebuilds, it increase more of fat also for the future purpose. So your body, when you reduce 10 kg, it increase as 12 kgs as soon as possible. But understand one thing, fats are not building blocks. It is a stored energy. It is your savings. when you lose something, your savings from your savings, you never go to a bank and take a loan to refill your savings, but you revive your savings when you earn more, right? Similarly, it may come back even if you lose fat, it may come back, but only when you earn back, when you eat more, or if you eat more of fat or more of food, it automatically stores for the future. After reducing fat, if you can control your diet, do more of workouts, then you can stop any diet and you can come back to normal life. But you must have a keen observation on your BMR and intake of food. That's the only thing what you have to do. So there is a different ways of weight loss. Now coming to the homeopathic part, uh, I think most of the people knows all the remedies which I am going to tell you, and you can guess the remedies if you want. Is this chat box working, Karthik sir?
Yes, it is, Dr. Shamir.
Okay, is there any queries or something in that
One minute.
chat box?
I'll just check.
Nothing, nothing, I think.
No, no,
Uh,
nothing.
yeah. If there is something, any suggestions on the remedy, you can just put forward. Any remedies which you have used and which is more effective for the weight loss, what you people feel. Coming to the medicines, the most common medicine, yeah, Phytolacca, Poonam Rani has told Phytolacca, wonderful. There are most medicines, iodine, Kalkareka, wonderful, wonderful. Anjali, yeah, wonderful. So here, let's try to differentiate some of the remedies which is used for obesity. Here in the screen, you can see two sides. That is a bigger list and a smaller list. The smaller list, sorry, I have not used it, but there are many clinical provings for these remedies for obesity, but I have not used it till now. The later bigger list, which are the most of the commonly used remedy. There are many other remedies too, but these are the most commonly used remedy from my part. So understand one thing is calcarea carb. Uh, when a obese person come to you, if it is a boy or if it's a boy, don't be shy to check for his genitals, because most of the cases I have seen is these calcirica patients will have very short penis, and they may feel that it is because it's obesity this penis has come smaller, but just correlate, these people will be having gynecomastia. Just when you see the people, if gynecomastia is there, then reconfirm it, tell them to show the genitals too, examine that if the penis is very small, it is somewhat similar to something like Klinefelter's features, like Klinefelter's. It is not like that the original Klinefelter's what we have studied, but the features shows of Klinefelter's. So it can be treated, because in the later stage in life, they may even go for infertility too. The infertility, the male reasons may be because of this obesity. There can be small penis, all these things, and even the male PCOD. I have seen even PCOD can be treated when you reduce fat, reduce obesity. Automatically, PCOD also comes normal. Okay, so this is the one of the major thing what I have seen. And one more thing I can tell you, some of we believe that obese thyroid leads to obesity, right? But I can tell you this obesity can lead to thyroid also, because I have seen some cases where obesity is controlled and thyroid come to normal, because in some cases you have seen T3, T4 is normal, but only TSH increases. In such conditions, when you reduce weight, your TSH also comes back to normal. It happens something like your body is so fat, your brain thinks, or signals are given in such a way that more of TSH is required. So automatically your TSH increases. So when you reduce fat, even TSH comes to normal. So this is the calcarea part. Then capsicum can be thought of. Capsicum, there must be, like I told you, people are very lazy who don't do any activity, very much less of physical activity, and burning or on normal capsicum symptoms also may be present in the people. Then other thing is Barita car, where people are little bit idiotic tendency or MR conditions. You can think of Barita carb. It has wonderful results. If he is very bad in studies or have adenoids and sleeps always with the mouth open, the typical adenoid feature with less of intelligence, you can think of Baretta Cup. Intelligence means it's not needed that he must be an MR. Even if he's bad in studies, you can think of Baretta Cup or even the thoughts or these things. Then Ferrum. Ferrum, as you know, you may be using ferrum phos for treating anemia cases, but in my experiences, ferrum metallicum 3x is one of the best remedy to treat uh, anemia. Okay, that never means if you give ferrum metallicum, your anemia is cured. Yeah, homeopathic medicines only has a tendency or ability to increase the absorption of required particles. Okay, even for the calcarea force, anything acts like that. So if your diet is having good amount of iron, still you are anemic, think of ferrometallicum 3x so that this iron absorption increases and the anemia can be uh, controlled. And even in the constitution side, the people who are pseudo-plethoric, old people tell always, obesity is sign of healthiness. When we reduce fat, they tell, okay, you are having some disease. The biggest example what I had is when I reduce my fat or when I reduce my obesity, some patients went to my wife and asked like, doctor is taking homeopathic medicines or allopathic medicines for diabetes. They never asked me whether I am diabetic. They confirmed that I am a diabetic patient because I have lost weight. So people have a tendency in their mind that obesity is sign of healthiness, and when you reduce your weight, your health is lost. So ferrum metallicum is one of the best remedy for such people who are pseudoplethoric, who is having anemia, who is very weak, but tends to be very obese people. Then lycopodium, where is hefty and your legs are more of weak. And with the gastric complaints, all these things, lycopodium can be thought of. And lycopodium, there is one symptom that is they fills up very fastly. They feel very hungry, but has very less, and their abdomen is filled and they stop. The appetite is filled and they stop. But after few minutes, again they feel hunger. That can such people you can even think of lycopodium. Then natromure, you can see for the thyroid complaints and all, natromure is having wonderful results. So constitutional treatment is one of the best remedy for this obesity. You must have a constitutional medicine in front to treat it obesity complaints, so that this obesity will not come back. Then coming to the mother tinctures and specifics, I told you Phytolacca had not got good results, but Fucus has given me good results. Fucus, wherever you have a thyroid complaints and thyroid has caused this obesity, Fucus is a remedy. And not a remedy, as a drug level you can prescribe. And Fucus, mostly what I do is 10 to 15 drops of tincture in the night. That's what I prescribe. And calotropis. Calotropis tincture, I prescribe mostly 5 drops 2 times a day. How to differentiate calotropis is that your body will be very, very, very soft, like a sponge, or very flaccid, soft body. Uh, More of fat will be there in your body. Okay. Such patients you have to think of calotropis. Then Gambogia. Gambogia is also one of the good remedy where the body will be more frigid. It's almost opposite of calotropis. And even Gamboge is used by many other systems also to reduce weight, even for Ayurveda and other nutrition part also Gamboge is used. this has a more of rigid body, but you are more of hefty. Such or dark personalities, Cambodia can be thought of. Then Phytolacca, I have given, but I not got much good results with Phytolacca. But who people is having with more of glandular affections and all, I used to prescribe Phytolacca. Then natron phos, I used to prescribe all the people who has come to me for obesity. It's in the 6x format as a triturations. So biochemic, I used to prescribe natron phos because natron phos is having this fat emulsification property. Then Blata, I even have not used it, but just seen that with asthmatic complaint, you can prescribe Blata. So these are the main remedies what I have used for treating obesity. Any doubts, anything, any queries, please come into the chat box so that I can clear your doubts. And now the major part, I'm going to tell you what diet or even for the ketogenic diet, what you can have. I am really sorry I missed it in before. What you can have uh, that I have missed up. That is something like you can have any non-vegetarians. It's very easy for a non-vegetarian, but it's very difficult for vegetarians. Okay, uh, for vegetarians. So here, vegetarians means you can take any leafy vegetables can be taken in the ketogenic diet. Any leafy vegetables. Then you can take something like cabbage, cauliflower, then broccoli, then cucumbers, mushrooms, and all these things can be taken for a vegetarian. And if you are a pure vegetarian where you don't take any non-vegetarian, then you can add up something like paneer, or you can even add lady's finger, brinjal. All these things can be added for your diet. But if you are an vegetarian, wonderful, you can go for eggs. You can have 3 to 4 eggs per day, and cheeses, any dairy products like cheese, butter, all these things are allowed. But don't take milk. Only curd and buttermilk is allowed. Okay. Then non-vegetarian chicken, mutton, beef, anything can be taken up. It's not a problem. But everything must be fried in coconut oil or olive oil or avocado oil, not in sunflower oil. Okay. Or in butter can be fried. Then even butter coffee, all these things can be taken in the diet. Okay. Then water intake. I told you even for the kidney renal stone, that's one of the biggest problems. So I tell any patients to take approximate 4 liters of water per day so that kidney stone complaint can be stopped. Because think of something, you have a bread and add some water into it. Bread always keep this water inside, but your oil always try to push this water. Okay, similarly, when you are on a ketogenic diet, your body is more of fat, or carb food is very less. So body tends to leave this water out. So you have to drink very good quantity of water in regular intervals. And whenever you stop this ketogenic diet, I'm sure that 3 to 4 kgs will increase back. So whenever you do a diet or tell your patients to diet or stop diet, if their aim is to stop at 70 kg, tell them to stop by 65, so that 5 kgs will be increased. That is a carb weight which can be which will increase as soon as you stop the diet. Okay. Then I have some doubts in the comment box. Why fucus at night? Even it can be given in the morning, but or every the fucus always have a very much of physiological dosage. So even if with boric you tell, it is almost told that uh, your weight, some people tell that your weight, according to your weight you have to give fucus tincture. So here I try to keep very much minimum, so that 15 drops of fucus tincture at a time is more important. So I felt the night is, because after the night, if you have seen, then early morning weight will be less, because uh, one thing is more of activity, more of healing process, or whatever muscles have broken in the morning, everything healing is more happening in the night and when you sleep. So if you want to reduce weight also, the night sleep is very much important. You must have 6 to 7 hours of sleep. Even if you are sleeping less, your weight starts increasing. So when you are on a good sleep and just before that you give fucus, there is a better action of fucus to act in your body and reduce more of fat. That's the reason why I'm giving fucus in the night. Uh, migrants. Mostly any conditions what I basically prescribe is a constitution remedy. I go behind constitution remedy for the first remedy. A single dose of constitution medicine is given for any diseases. That's what I do. And as I told you in the initial phase, there is this obesity is not at all a disease part. So if you have something of disease part, constitution remedy is the best thing. Then why I give tincture and this biochemic is only to accelerate the condition. And second part, what I do is uh, what to say that whenever you reduce this fat, you may tends to have this loose skin or stretch marks, all these things. So these can be controlled by the scalotropis, gambogi, and fucus. Because I told you calotropis is having a loose body. So when your fat is reduced, your skin will be shaggy. So this can be treated by calotropis. Your body becomes more of rigid. That's what calotropis do. So such things can be even if it's fucus also gambogi also in the later second or third month I used to prescribe calotropis according to their skin how much saggy the skins are. Because calotropis is actually having wonderful results on saggy skin. Then mustard oil can be used. Sorry, mustard oil cannot be used because it is only the saturated fats can be used. Only butter and coconut oil is the best thing. Even olive oil and avocado oils are not for cooking. It is mainly for salad dressing because it is monosaturated oils. Blood group diet, sorry, I have not tried it. Without trying, I cannot tell you. Please show me some sample diet charts. Okay, here I can tell you something that is what I have done. Okay, sample diet chart, I told you it must be according to the BMR. But what I did was a morning 25 grams of butter coffee. Butter coffee means a butter. Desi ghee can be used. Wonderful. Butter, 25 grams. What is according to my BMR, mixed in hot coffee or hot tea, or even butter alone can be enough because 25 grams of butter is a very much good quantity of calories. So it's almost equivalent to 2 or 3 puris or chapatis in the early morning. It's almost equal to that 25 grams of butter. So that is the important part. Butter can be taken, and when you take butter, you won't feel hungry till afternoon. And first, second part is that, and first most important part is that butter is completely fat. So what happens is insulin is not deposited in your body. So automatically your body tends to feel as an intermittent fasting. Your afternoon and night food will be calculated as food insulin as insulin is deposited, and morning will be almost similar to intermittent fasting. And afternoon food, what I used to follow is 3 eggs plus a slice of cheese. What I used to do is I used to whisk this eggs nicely and put coconut oil and this egg on that. I used to top with some leaves like lettuce or cuss, all these things, or even microgreens. I hope you know about microgreens. Microgreens is one of the best leaf which you can get, which one of the best nutrition part, and it can be made very easily at your home itself. So microgreen is one of the best thing you can have. You can add this microgreens in food, and it can be used as a diet. Okay. Then dinner, I used to take nearly 250 grams of chicken, mutton, or beef fried in coconut oil with some salads. Okay, salads means cucumber and these vegetable salads. That's what I used to take. This is a basic diet what I followed, but don't think very similarly because I have told you vegetables which all are allowed. I used to do some days when I get bored. I used to take this egg and cauliflower and mix together and make cauliflower what cutlets also. Even that is possible. So think innovatively so that your diet. Think simply that is wheat. If you are North Indian, the wheat is a major part. You make puri out of wheat. You make uh, chapatis. Everything is from the wheat. Or if you take rice, you make ghee rice. You make pulao. You make biryani. You make if you're Malayali, you make puttu, dosha. Everything is from the rice. The same rice in different formats. So similarly, think of something differently with all the ingredients what I've told, and you can make wonders out of this diet. It's one of the best diet what I have followed. Okay. Uh, the intermittent fasting is one of the best diet what you can do. It has almost like 8 hours of diet and 16 hours of fasting. You are supposed to eat 8 hours eating window and 16 hours of uh, fasting. And this is my photo when I was 3 to 4 years back, and I weighed maximum of 122 kgs. It was me, and you can see the double chin or the complete what has happened, and now what I am. Okay, so this is the change what have come to me, and I don't think you can point it out that I have reduced weight, right? Because this is the wonder of homeopathic medicines what I've given. Even for the ketogenic diet, you have something called keto flu or vomiting feeling or giddiness or keto rashes, which can be treated wonderfully with the medicines. The if I asked you who is the superstar of homeopathy, the best answer will be arsenicum album in this scenario of COVID. This asal itself has given me superhero style in the time of keto flu. Keto flu will always have that uneasiness of having food, vomiting feeling when you smell food or see food, vomits or diarrhea, all these things, which is wonderfully covered by arsenicum album. And I used to prescribe arsenicum album as SOS for these people who are doing ketogenic diet. And if they want, they used to have this. But when the constitution medicine is perfect, you will not need this SOS at all. If your constitution remedy is wrong, this SOS will be needed. Okay. So this is my part, and I think you can have my phone number. If any doubts or anything about the diet, I'll be ready to help you out. I think I have taken some 15 minutes more from the scheduled time. And one more thing, that is take care of your body. It's the only place you have to live in. Okay, it's not your house, it's not anywhere. It is your body where you live. So take care of your body and do more of exercise. Physical activity must be more. Take care of your body. And thing is, if you are a Malayali or if you can understand Malayalam, then you can follow me on my YouTube channel where I opened up mini series for weight loss. But sorry, it's only in Malayalam for more people to understand from my place. This is my YouTube link. And thank you all for your patience hearing. I think I have given some points which may be helpful for you in your future treatment of obesity. I don't know whether I have enlightened you with many things, but some things which I have experienced, I have told you. And any doubts regarding any patients, you can just message me, and I am ready to help you out. Thank you all. Over to you, sir. Karthik sir.
Thank you, Dr. Jamil. That was an amazing change that 4 years ago to what you are now. That's totally amazing.
Thank you, sir.
Is that only diet or you were also on some homeopathic medicine?
Yeah, I was on homeopathic medicines. I told you, like whenever I faced many problems. Like I have once fainted down. I have vomited very badly. So such things has happened to me. When I was doing my ketogenic diet for the first time, it nearly took me 6 months time to study what keto diet is, because it was entirely different from what textbooks told us. So after that, when I studied this, I did this, and I faced multiple problems. So I tried to experiment on me because it's better to experiment on me rather than on my patients.
Definitely.
So later, when I really didn't thought of doing it as a diet plan, but what happened is most of people when seeing my change, it happened in a span of 6 months. So people were really amazed and people started asking me. So it was very difficult for me to talk to them in the roadsides about this diet or homeopathic medicine. So I told, okay, I started my obesity clinic, come to my clinic so that I will explain to you. And that's the reason I told you I keep people also very limited so that I can concentrate more of other diseases because I feel more of passionate or to treat or miraculous diseases rather than obesity because obesity it's wonderful that we treat them, but it is not that life-saving situation for a person. So I feel more thrilled to treat such diseases. So I keep this aside for monthly 4 to 5 days, and rest I treat other diseases.
Other disease. Oh, that's amazing. The information that you shared
Yeah.
was really good. Would anybody like to ask Dr. Jamil anything? Dr. Jennings? There was one about the dosage. How would you work on the dosage? Somebody had written on the Facebook
Hmm.
post,
Yeah.
live stream. How would
Yeah.
you look at the dosage for a remedy?
Dosage.
How would you
Uh,
arrive at the dosage of of a remedy?
Dosage, what I do is in tincture format. I told you I try to keep most minimum. The initial phase I used to prescribe 7 to 8 drops, but later when I tried to reducing it, I thought 5 drops is much better as the results are oriented. And I told you fucus, it's having more of physiological action, so it must be given in a larger quantity. So most of the Star Wars are telling about 2 times fucus, but I tried maximum to keep minimum because I don't want to give more of tinges. I prescribe very try to prescribe very less of tinges.
Mhm.
But when these conditions like it's not a disease, but you must have some physiological changes like or skin tightening or stretch marks to be solved. Such things, these physiological doses are more of important. So from my trial and error method, I have come to this dosage.
Right. Doctor, the other thing I wanted to ask is
Yeah,
when you lose weight, you have a lot of flabby, loose skin around your arms or on your
yeah,
stomach in your midriff, right? So
yeah.
how do you handle that? How did you handle that?
Yeah, the first thing what I had to understand is most of the weight loss, what are the most of the weight loss schemes, what is happening around is sudden weight loss. But I can tell you, never lose 10% of weight, more than 10% of weight in the first month. You have to control that. First month means if you're 100 kg weight, your maximum weight loss must be around 10 kgs. Okay, don't go more than 10 kgs. And according to BMR, if you're having, this will be controlled. Uh, and according to the way, and I told you, exercise is one of the important parts so that your weight loss is there. If
Right.
you are not doing weight loss exercise, the weight loss will not be there. Okay, it is not very easy to lose weight. You have to struggle a little bit so that your weight has to reduce. So when you do exercise, your muscles also tends to be more stronger, and this flabby skin can be solved. And I tell them people like after first month, I tell most of the people to do go for HIIT, that is high intensity interval trainings,
Training.
so that your muscles are also strong. And if you have a flabby skin, I tell them to go for some small dumbbells to buy at home and do some few exercise. I demonstrate them some exercise so that they do. So how that's how I make this happen. And when you're on this proper BMR monitored diet, you will not have this flabby skin.
Lovely skin. Okay. So that was really nice. Can dal's lentil be included in the keto diet for vegetarians? And why
Okay.
sunflower oil
Uh,
is not recommended?
yeah.
Dr.
uh,
Dr. Priyanka.
out and to measure the fat percentage, right? Okay, here we can go like dals and lentils is, sorry, it's not for ketogenic diet, or it is high in protein, still it is high in carbs also, so we cannot go for dals. Okay, and why not sunflower oil? Because sunflower oils are unsaturated oils. So when it heats up, it breaks up to smaller compounds, and that is harmful for this ketogenic diet. And it will not tends to go for a ketogenic diet. And one more thing, one more thing, you may have one doubt is when you take more of fat-rich diet, will you go for a cholesterol complaint? That may not come to your mind now, but after this section, it may come to you in your mind. So understand one thing: initially, first month, your cholesterol levels will hike because I think you know that these cholesterols are made from your body itself. It's not external cholesterol which you're taking alone. It's a byproduct from your liver. And plus, and you are taking more fatty food from outside, so automatically in the first month there's a production from your body plus extra from outside. That's a double intake. Second thing, your body fat cannot be vaporized. It is, your body fat is broken up into two parts, that is, one is LDL and one is triglyceride. Your body fat breaks to LDL and triglyceride. This triglyceride is used up as similar to your glucose, but your LDL goes to your liver so that it breaks down later. So whenever it is broken up from your body and goes to liver, in between itself you take blood to test, right? So automatically your first level of LDL hikes in the initial phase. So whenever you have a patient whose LDL is high and triglyceride is less, understand one thing: it may be a sign of weight loss. It may be a sign of weight loss. So think of that also. And if it is too much more, there are some people who are cholesterol like hyper respondents. So such people, whatever you eat, even if you don't eat, also your cholesterol level will be very very high. So such complaints, people, you think of some antipsychotic remedies like medorinum, which gives wonderful results in such complaints. Like even if they are not eating a single drop of oil also or single piece of non-veg, they are pure vegetarians may have high cholesterol. That is because they're hyper respondents to cholesterols. So here you can go for medorinum, medicine like medorinum or any other constitutional remedy. I have got good results in anti-asthmatic with the medorinum 10 a single dose. Maybe one dose is enough for 2 to 3 months, and it has shown wonderful results. Even with allopathic medicines also, they may show high cholesterol levels. After giving medorinum, after 1 month, you tell them to taper down the cholesterol drugs, allopathic drugs, and it comes to normal. And plus, if this LDL high can be controlled with homeopathic medicines also if it is too much more, like Aryan Sateva or Pulsatilla. Pulsatilla 30 is one of the good remedies for reducing cholesterol levels. Then how to measure fat percentage? And I told you the real method of measuring fat percentages with fat caliber. There's an instrument called fat caliber, but it is very much impracticable in India because you have to check in the abdomen side. So when you, and most of the cases where I have seen obesity cases will be more of female complaint, female patients. It is very difficult for them to measure. So what I do is I measure with waist, hip, and I told you that there are many lot of apps available in the net. Just type Google, go to Google, go to fat, how to measure fat percentage, and you just enter the height, weight, and other measurements, and it gives away the fat percentage. Or else you can use one method is there are new weighing machines where we can calculate fat percentages. Even that can be used up. But thing is, you have to go for a good quality one. If it is normal one, it may not give you the accurate fat percentages. So that's our with the doubt. I think it's clear.
Yeah. Okay, this is slightly different from the topic that we're discussing.
Yeah.
What would you talk about? What would you say about statins? Stat
What?
statins.
I didn't get you. Sorry.
No, what do you have to say about statins when they give it for high LDL
Okay, statins. Okay.
statins? So,
Uh,
what is your impression about that? When you lose weight, you can tend to have a high LDL level, right?
yeah. Yeah.
So,
But it is one of the very commonest or very much normal things to happen. So what I do is, if the patient is on statins, then I tell them to continue for a month because they are very prone to have a high cholesterol level. So whenever we stop it, it shoots up very high. Plus, weight loss also increases the cholesterol. So it may high very much. So in these conditions, I told you as an anti-asthmatic medicines, I used to prescribe them. Plus, for 1 month, I tell them to continue the statin. Then later, I used to taper it down. And even for the this one also, insulin remedies, metformin, all these things.
mm,
Even for PCOD complaints, they used to prescribe metformin. So even here, I used to stop this metformin in the initial phase of PCOD if they're telling itself, and I used to give away with the medicines and diet. And I have even tried because it's all experiment to be tried, right? All the research is to be tried. So I have tried with placebos and with the diet PCOD. Even that has given me good results, but better results was with our medicines because it was much quicker within a month. And one thing you have to say is, for the if your menses are very much normal, it may get abnormal for the initial month. Okay, but if you are a good in a correct constitution remedy, it sorts it out. Otherwise, it may tends to be irregular in the initial month. But if you are on a irregular menses, it used to come to normal in the initial month itself, because it is this diet has directly action with the your hormonal changes. And also initially there will be a slight variation of the hormonal changes in the initial month. There are a lot of changes to be happening in your body, like high this what to say, uric acid levels or cholesterol levels. All this happens. So think on that, prescribe a remedy according to that, so that you can take care of this. Okay, and so that this complaints won't come from the patient, and tell the patient what is going to happen in your body, so that they are also happy. If sometimes somebody will tell them to check cholesterol, and if they check cholesterol and it is too high, they get frightened away from this diet. So tell them well in advance what is going to happen. And people who is having repeated kidney complaints, tell them to take at least 2 liters of 4 liters of water and 1 liter of lemon water daily with salt, so that this comes to normal. And so that and even when I tell about this, you may have a doubt whether in high BP conditions what we can do for the salt intake. I have seen that initially from the first month itself, the BP is coming normal. So you can go with the salty lime water. It is not big a problem, but keep in a medium level of salt.
okay, doctor. That was good. So, does anybody else have anything to ask Dr. Jamil? I think we've taken a lot of your time. Thank you.
No
Thank you
issues.
so much, Dr. Jamil.
Thank you. Thanks a lot.
Your passion shows.
Yeah, it's happy. Like when I had a change, I'm very happy to when I see that people also have changes accordingly.
Right.
Even I see like some of the infertility cases, when allopaths tell them to reduce weight, they come to us.
Okay.
And when I have to tell you that whenever you treat such conditions, tell them well in advance, your infertility also can be corrected here. Because what happened in my first case was, they were infertility, they were struggling for a baby for past 2 years, they were not having baby, and in my treatment, first month itself they conceived.
See. Okay.
And I know that it's because my constitution remedy has acted here. but I cannot claim it because I have not told the patient that I am treating for this
Okay.
infertility also. I have told only the obesity, and it went in credit of other ones. So they
Natural.
were trying for many months, and still they were not getting conceived. And from our 1 month treatment, this happened. But we are sorry, we are not able to claim it out.
Was it Natramur that you?
I don't remember. I don't remember that. Really, I don't remember.
Yeah.
Maybe.
Uh, anyway, I'd like to thank you, Dr. Jamil, for sharing all this knowledge with us, your experiences, and I hope we've learned a lot from this. We've learned a lot from this, and I hope we can use it in what we do in the daily practice. Yeah.
Welcome. It's my pleasure to be here.
All right, Dr. Jamil. Thank you so
Okay.
much, and we hope
Thank
to
you.
see you all soon. All right.
Sure. Thank you.
Bye.
Bye. Yeah. Thank you.